Welcome to FMCSA Clearinghouse Training, how to add Employer Clearinghouse Services to your consortium. First, let's discuss what the FMCSA Clearinghouse is. What is the Drug and Alcohol Clearinghouse? It is a database, yes it is, but it's much more than that. This database was organized to help employers and medical review officers report positive drug testing, refusals, and other information like return to duty, follow-up, things like that. The purpose of the database in the clearinghouse is primarily to help the government manage all of the hundreds of thousands of employers. When I say employers, that means carriers, owner-operators, as well as the 7.8 million drivers in this country for drug and alcohol testing. The clearinghouse is set up to be secure, so you can't just see anyone's information. They can't see your employer's information or the clients you serve. You can only see information as you've been designated for, meaning you have to receive an invitation to service an employer. That's the only way that you as a consortium or a third party can get in, and you must be a designated TPA service or a consortium, which basically is the same thing. They just may offer different services. But if you are a consortium and an employer has hired you to manage their services in the clearinghouse, then you have access. And a lot of you will be consistently adding owner-operators and employers. So you will have designation for each one of your employers and owner-operators if you choose to offer this service. So the final rule was published back in December 2016, December 5th, 2016 to be exact, but the actual requirement, the mandatory registration, started January 6, 2020. We've waited a long time for this database to become real. For those of you that are doing the DOT exams, this is equivalent to the DOT exams when it comes to the government managing how many exams are being done, who's doing the exams, are the employers making sure that their drivers have current updated medical certificates. It's the same with the drug and alcohol testing. We now have a system that controls when employers are ensuring that their drivers are being drug and alcohol tested. There is no more all over the board. If you're not in the clearinghouse, then you're not following the law, and they can track that now because it's not just the employers reporting, it is everyone reporting, specifically the MROs and also consortiums like yourself. You work on behalf of the employer, but there will be checks and balances in this system. The purpose of the clearinghouse is also to increase safety on our nation's roads. And you should be familiar with this concept from doing DOT exams and DOT physicals. It was the same premise. Everything that the government does when it comes to regulations, I know a lot of people don't like to hear this, but it is to protect the public. No matter what the regulation is, it's not to make it difficult on businesses or employers. It is always to protect the public. And I'm an advocate of regulations now because I understand why we have regulations. It's not always everyone that's doing things wrong, but you do have the vast majority that is not doing what they're supposed to do. Regulations happen because people don't do what they're supposed to do and they don't follow the law. And when it hurts other people or it hurts the public, regulations become real. It's very sad that that's the way it has to be, but that is the reality. And so now we understand that employers and owner-operators are not drug testing. They're not alcohol testing the way they were supposed to be. This is not a new law. This law has been in effect for many, many years, back since 2000. And many employers have been able to get away with not doing it because they don't know, or they don't understand, or just pure negligence. So what we will have with the clearinghouse is real-time access to violations that are being reported. Okay, because the MRO and you, if your employer wants you to do this for them, you guys will be reporting this information, the violations. Also, it'll be easier for employers to check on pre-employment challenges, like, for instance, drivers that hop from carrier or employer to employer, or owner-operator to owner-operator. They won't be able to do that anymore without getting a mandatory pre-employment drug test and an investigation report. The clearinghouse will hold all of that information. And it'll make it more difficult for these drivers to hide their drug abuse and alcohol abuse and their violations from employers, because all of the employers will be able to see this information. And if a driver does not give an employer access, or consent, I should say, then there is a problem. Then also it gives more insight into employers' compliance. Again, I go back to the regulations. When businesses, meaning employers and carriers and transportation companies, do not follow rules as it relates to drug and alcohol testing, that's when we get new regulations. And they're always coming because employers don't do what they're supposed to do. But that's what the clearinghouse does. It makes our roads safer. It protects even you and I as business people in the DOT occupational arena. So who is required to use the clearinghouse? Drivers that hold CDL licenses, drivers that are in trucking and transportation schools. So if you're learning how to be a bus driver for a school district, you will be a CLP, and you will need to get not just a DOT exam, but a drug and alcohol test before you get on the road. All employers, which are also known as carriers and also known as owner-operators, third-party consortiums working on behalf of the employers, medical review officers, those medical review officers that you work with, even if the employer does not know who the MRO is. If you use the MRO for one of your employers, that MRO will report any positive drug test, and also they will report refusals to test. Even though you reported on behalf of your employer, if they hire you for clearinghouse services, it's going to be reported regardless. That way the government can see everyone doing their part. Now for alcohol, remember, the MROs and the labs have nothing to do with alcohol. You and the employer are the only ones that have the alcohol information. So if an employer does not hire you to update his or her clearinghouse, then they will need to update it themselves. Also, substance abuse professionals, which are also known as SAPs, they report to the clearinghouse. These are the people that come into play with return to duty and follow-up. This is after a driver has been pulled off of his or her job because they were testing positive on drugs or alcohol. They have to see a SAP and go through a full process. Then also state driver's licenses agencies, which are often called DMVs, that's what we call it in my state, Department of Motor Vehicles. They can also see what's in the system. Everybody's working together. The DMVs, or state driver's license agencies, they are the ones that will often ask the drivers for proof that they participate in a drug and alcohol program. What actions must users take in the clearinghouse? Well, generally speaking, there are three actions that clearinghouse users will focus on. That would be to record driver information about drug and alcohol violations and other related information like pre-employment and return to duty. Consent. Drivers, CDL drivers, will need to consent to an employer, or give an employer approval, authorize them to check their background before hiring them. And this includes while they're employed with that employer. I'll talk to you about the annual checkups later down in the presentation. Query, the employers and You, as the consortium owner and or authorized clearinghouse manager for your employers, will query the clearinghouse to look for information annually and for pre-employment, not just to report. Owner-operators must complete the following actions in the clearinghouse. There is no discussion about if, they must. This is mandatory. So owner-operators are also known as employers. Owner-operators, as mentioned in previous trainings, the difference is that they actually drive. So they have a business, they own the company, but they actually drive for their company as well. So they get DOT exams, drug testing, and alcohol testing. So they have to be put into the system because they don't get a pass from the regulations. Now, owner operators must be with a TPA/consortium, meaning they don't have an option. If it is just them, they must sign up with someone like you. This is why it's important for you to go ahead and make this decision, because more than 80%, maybe even 85% today of our drivers in this country, transportation all over, bus drivers, truck drivers, delivery drivers, all of them represent the 80% plus category. So most of the business when it comes to exams and things like that comes from the owner operator group. Even if they have 5 other drivers, they're still small and they may be driving themselves. This is a key market for you. Everyone wants to get to the larger companies, but we only have a handful of those. I mean, literally. Most of those larger companies are not even direct employers of some of their drivers, a lot of their drivers. A lot of their drivers are owner operators. Owner operators make their own decisions, and so when you are doing an exam for an owner operator and you ask them, are they registered in the clearinghouse, and they say no, you tell them about your service, because by law, even if they don't know, you don't want them to get into trouble because it's coming. So you may as well bring it up to them so that they don't go and give their dollars to someone else that can't even provide direct services. CDL drivers, they need to register as a user because they have to respond when employers are asking them for their permission to review their clearinghouse records and also their substance abuse records. Even if they've had some issues, as long as it's cleared, as long as they've done everything they need to, they will be fine. Employers and third-party consortiums will also register. Remember, an employer and owner-operator are the same when it comes to being employers, but the owner-operator drives and is still driving on the road or would like to keep their CDL license, whereas an employer simply has employees, drivers. They are not driving themselves, so they don't need to get a physical or drug and alcohol testing. Most of these employers are a little bit larger, maybe 8+ drivers, maybe even 5+ drivers. And let's say they only have 2 drivers, but they're not an owner operator. They would go under the employer category. So they need to register and they need to inform their drivers of their company that they will be asked to give consent to check their clearinghouse, okay, their clearinghouse information. And then employers and consortiums are required to query. You would do it on behalf of the employer if they gave you permission and purchase your services, but they're required to query current employees once a year, and they're also supposed to do pre-employment, okay? Pre-employment checks for every person that your employers or your owner operators bring on. And then also they're supposed to, when I say they, you and your employers as your clients, you're supposed to report drug and alcohol violations, positives and refusals. You're supposed to also report negative return to duties and controlled substances. You need to make sure that when people come back to work, that they've done everything they need to do as per the clearinghouse system, and that they've successfully completed a driver's follow-up testing program. Okay? Those are the things. All entities registering for the clearinghouse must have a login.gov ID. If you don't have one, which most of you probably do because you're doing the exams, you need to create one. And I will have in the portal, in the consortium portal, the exact document step by step that you need to use to go ahead and get yourself registered. Once you're registered, all of your other employers and clients, your employers, your owner operators can invite you to manage as their assistants, can invite you to manage their clearinghouse activity. Now, some of you will need to help or assist your employers just to register, okay? But once they're registered, your employers and owner operators, you can see or use this chart, which I will have a separate document just for the employers and the owner operators on how to create a login and then how to select their role. I should say how to select your role and how to make sure that everything is linked together. The employers already have an account. Some of them may not realize it, but they have an account, a portal account. If they have a US DOT number, they should have an account. And if you haven't figured this out, the government is trying to manage all of us by one login ID. That's login.gov. So you'll need to walk your employers and your owner operators through the process if they don't know what to do. And remember, the government does not want you doing it for them. They will allow you to manage for them, but they want the employers at least, at minimum, to sign themselves up for the clearinghouse. But once they're signed up, you're already signed up, they can send you an invitation to become their consortium. Drivers, the same thing. Here's a step-by-step diagram for the drivers. We will have that in the portal as well. We want you to be able to put your hands on a document step-by-step very quickly where you can help drivers and help employers. The drivers only need to be in so that they can allow consent for the authorization and also to review what's being reported on them. They need to check that out as well. Here's the same setup for consortiums and TPAs. You register using this diagram. I have a full document for you to go step by step, especially if you've never created a login.gov. I believe that everyone on the NRCME side should have a login.gov. I believe our time is up for making sure that we've registered to combine our registry accounts with our login ID account. So most of you guys should have a login ID, but when you log in and you choose to set up your clearinghouse registration, you're going to select your role, provide your contract information, your contact, information, make sure that everything matches up, agree to the terms, and you're in. Okay? So this is just a picture of the process. There is a document that will be in your portal that walks you through registering as a consortium in the clearinghouse. Now it is pretty easy, but you do need to be aware of some of the other steps you need to take to accept invites from your employers and your owner operators. Now this is a snapshot of how the employers designate you as the consortium or their TPA. So of course you have to be registered as it says here, and I've said more than once. You need to be registered first. Then the employers can select the actions they want you to take on their behalf. Now for owner operators, they must designate a consortium. Owner operators don't have a choice if they're the only ones. Now if they have 3, 4, 5 drivers and they want to set up their own program, they can, but I've already helped you to understand that most of these employers and owner operators are not going to do it on their own. The mandatory consortium setup is for owner operators that are by themselves. If you're only one by yourself, you're just self-employed, you must be with a consortium. And remember what I said, our owner-operators are 80+% of our market and the people that we serve under the DOT Occupational Health arena. Query requirements. What must be done by the employers and or consortiums on the employer's behalf. Pre-employment screening must be done to ensure the prospective employee is not prohibited from performing safety-sensitive functions. Okay? So, and you know, pre-employment situations also goes to the schools, the trucking schools, bus schools. It goes to those entities because they're treated like employers, okay? Also, employers and consortiums will be required to do annual verifications to ensure that their current employees or drivers are not prohibited from performing safety sensitive functions. So once a year, an employer or you on behalf of your employer must go in to check these things, okay? Just to make sure. And for pre-employment screening, you're going to do an in-depth, which is considered the full query. And for the annual, you're going to do a limited query just to make sure nothing's in there. If something is in there, then you're going to go and do a full query after you've done the limited. Now keep in mind that employers and owner-operators must pay for a plan to query. And you cannot do it for them, they must do it. So they don't have to buy it right away, but they will need to because they have to do the queries throughout the year. And you will need to remind them of that. In some cases, it can be a little inexpensive. I'm really surprised that the government is doing this because these guys have so many things to pay for. This is why you want to make sure that you're giving them fair pricing, that you're not nickel and diming them to death because they are being nickel and dimed to death all over the place, especially with third-party consortiums. So they do and will eventually have to buy a $1.25 query plan. And I know this is small, but if you look over here, you can see the plan size for how many drivers, and then you can see what it would cost. The plans can go as high as $24,500 for an unlimited query plan. Now, there are some large organizations that will do that, but you can also get an individual one for $1.25 based on how many drivers you have. So when you conduct a query, you're going to enter the driver's information. This is what it looks like. There will be a step-by-step document on that as well. This is what it looks like. You put in their date of birth, their name, their driver's license number, and the state of issuance. And then it'll be verified within the system. And you have 2 attempts to try. So make sure all of the information is correct. Okay? If the information cannot be validated, the query cannot be conducted. So make sure everything you have is correct. During your attempt to do a full query, you will be prompted to send the driver a consent request. That driver will need to go ahead and respond to that consent before you can complete the query. So this is what an employer's query will look like. This is what it will look like when you do a query on the employer's behalf. Here to the left at the top, you will see the name of the owner for the USDOT number and the employer's information, the status and the result of the query, especially if you're looking for the fact that the driver may or may not have reply to your consent. If the driver does not give you authorization, you can't complete the query, okay? And then you'll have to talk to the employer about that so that they can get the driver to do it. But here's the driver's information right below the company name and the owner's name. And then you will see the additional information where it says consent info. It'll show the date requested, recorded in the status, and then you will see to the right the other detail, the overview of what was requested, all the information, and then you'll see the driver's open violations, okay, if they have any. But it's very, very detailed. So you'll get a chance to see if you're getting what you asked for and if you did everything correctly. Now this is the driver's view of the violation information, if they have any. This is what their history would look like. So you won't see this, but the driver will see this. It has their return to duty status, if that's the situation, because remember, if they came up positive or they had a refusal to test or they were off work for a very long time, this could be for any reason. It's going to show all the details, the return to duty status, the driver's information, the violation information, their notice to appear, the driver's employment status. Remember, this whole return to duty thing, you don't control it, the employer does. The employer has to manage it. Once you report a positive or a refusal to test or a driver is out sick for a long time, it is up to the employer to follow the law, the regulation, and take the necessary steps to remove the driver and make sure that they go through the return to duty process. Some drivers don't go through the process. Maybe they got away with that before. They won't get away with it again. Their entire livelihood will be destroyed if they don't conform, because it's not like they can't come back to work. They just have to go through the process. Now let's talk about which violations get reported to the clearinghouse. So, who will be reporting to the clearinghouse? Who will report the violations? First of all, MROs and SAPs, substance abuse professionals, substance abuse counselors, will report to the clearinghouse. MROs will report within 48 hours positive test results, adulterated test results or substituted drug test results, refusals to test, and then changes in a verified test. So the MRO will immediately take that information and report it. And you will report it too on the employer's behalf. But this is a checks and balances system, even though they don't talk about it that way because they don't want you guys to think of it that way. But if the government does not see information from the employer side that validates the MRO side, and I shouldn't say validate because it's the other way around, they will know that the employer is not in compliance and they're not doing what they're supposed to be doing. Just because the MRO is going to report it does not mean that the employer is not going to report it or make sure that it's in there. Employers and their TPAs, consortiums, will also be reporting violations to the clearinghouse. So as a consortium reporting on behalf of an employer because they took your services, your clearinghouse services, you would report an alcohol confirmation test with a concentration of 0.04% or higher. Now remember, I know I sound like a broken record with this alcohol thing, but you guys are the only ones that have alcohol documentation. MROs have nothing to do with that. So if the employer doesn't do it on his own and he's not part of your consortium, or he or she has not taken your services, it may or may not get reported. This is why it's smart for them to go ahead and hire you to do this. They will be out of compliance if they don't report alcohol confirmation information. If they hire you, you can do it and they're safe. But you two, you and the employer and us, if you're with us to do the randomizing, because we wouldn't just report, or when I say report for us, we would not just create a report just for the randomizing. We would also have other positives and other details for other situations that could violate drug and alcohol policy on our report. Okay, so, and just in case, when you get the report, you'll look at it, and if you missed reporting that, or the employer didn't allow you to report that, you could identify that before the employer or the owner operator gets into trouble. Also, refusals to test, refusals to test for drug also need to be reported. Now, one thing I do want to check on is For the drug testing, and I'll get back to you guys about this, MROs are reporting the drug testing side. You guys are too, or the employer is supposed to track it too. I just want to make sure that we both have to do it because it almost looks like you're going to be reporting the same thing. What I want to check to find out is the government okay with that? I realize that you guys have your portal that you're reporting into for the employer and the MRO has his or hers, but I just want to get some clarity on that, okay? But in the meantime, you should understand that you're supposed to, on behalf of the employers, report all positives, all refusals to test, okay? And then what else? Negative return to duty test results are supposed to be reported as well. What that means is that you can now demonstrate for a driver that you're hiring that you check to make sure they completed their follow-up testing and that they're allowed to be back on the road. So what violation information do employers and consortiums need to report? Well, you're going to give the employer's information, their name, of course, their company name, the driver's information, their date of birth, their commercial driver's license number, their state of issuance, the type of violation, which may require a little more information, the reason for the test in the first place, and then the date of the test. And if it's a negative return to duty, if it's a return to duty situation, you need to make sure that you report that it is a negative return to duty. Hopefully it will be. And then the date the driver successfully completed the follow-up, okay, ordered by the SAP. So again, we have some dual reporting, but part of that is the checks and balances system. Now, I believe, as we were discussing previously on the previous slide, when I mentioned about the MRO reporting positives, I looked it up, and the MROs actually are going to do some additional work for the positive. So they'll run an initial test, but remember, you get charged that extra fee every time there's a positive test result. So the MRO is going to take that further and make sure that it's positive. That's what they're going to report. They will also report on adulterated collections and things like that, but so will you. Some things will happen to where the MRO doesn't have to do anything, like for instance, a refusal to test. You're going to fax that over to the MRO just so that they know what happened and you have a record of it, but you're going to report that and the MRO would have that in their records as well. So don't fret about the types of positives, just report what you do and what you know. They will let us know if we need to correct how we're doing something. So this is what it looks like when you need to report a violation. It's a three-step process. This is the driver's information, as you can see. Okay, it's very simple. And all of that information I just mentioned, you will put it in this system. Now, you'll get to this through your dashboard, but again, there's a step-by-step document for how to upload and report violation data. Okay, so don't worry, you will have instructions. This is step 2 of recording and uploading violation data. You see here you have an alcohol area for violations, drug area for violation, and then you're going to click next, and then you have some other detailed information over here that you may need to respond to. But it's very easy to do, very much step by step. You can see what you're doing and you'll get used to it, but use your instructions until you've done it a few times. Hopefully you won't have to do it that often, but I mean, that could happen. Just make sure that you follow step by step because this is serious business. You don't want to make a mistake and report the wrong driver. Once you've done steps 1 and 2, you can review the information and hit submit. Just make sure that everything is correct. Again, this is very serious business dealing with driver's information because if you report the wrong person, they have to go through a lot of changes to get this removed. So make sure you're being very careful. What services can you offer through your consortium? Well, now that I've walked you through pretty much what you're going to do if you offer clearinghouse services, it includes pretty much the annual queries, the pre-employment, posting the positive and the adulterated and refusal test results. It's pretty simple. It's very consistent, but it depends on how many drivers there are. But it is a very simple service to offer. You just need to walk through what to do. I just did most of that with you to give you a very clear understanding of what this means. This really is a service. It's a support service, but it definitely does require additional revenue, meaning you can't do this for free unless you can just afford to do that and you put the cost in your consortium. But really, nobody can afford to do this because it can be a lot. If it's only one owner operator, fine. But if you're going to have 50 owner operators, it's something that you need to pay attention to. It's requiring staffing, and you need to focus and pay attention. So it's management. It's management, administrative management. So make sure that you really think about the things you'll need to do in order to offer the clearinghouse services as part of your consortium. So how much can I charge to add clearinghouse services to my consortium? Well, the verdict is still out. Currently, pricing is all over the board. It really depends on the consortium, meaning the third-party consortiums are the ones collecting the money. So we are so excited that we have you as part of this program because now you're going to stay ahead of the game just like they are, and you can offer your employers and your owner-operators the same except better because you offer all the services. They will be right there with you, and you can help them stay compliant because that's the most important thing to them. But whatever you believe is fair, go ahead and charge that. Just make sure you're competitive in your area. You're not going to be able to call urgent cares and ask that question because a lot of them don't have their own, but you can look up in the telephone book or Google your zip code and find consortiums in your area or even consortiums that are not in your area. Remember, a lot of consortiums are nationwide, and find out what they're charging. You have to tell them you are a small trucking company, you're just starting up, or you're a small bus company, but get that information. This is what we have learned thus far. Generally speaking, employers and owner operators are being charged anywhere from $9.99, that's probably per owner operator, and all the way up to $19.99 per month. Okay, so you could have an owner operator, maybe they pay $9.99 a month or $9.99 times 12 to pay an annual. Okay, or if they have more drivers, maybe they pay a little bit more. Because you are handling them as an employer, it's not like your consortium where you should charge them per driver unless you're charging them like $2 per driver or something like that. But just be very careful how you do the pricing. But right now, you can decide what you believe it's worth. Just try not to overcharge and make sure your pricing is clear. You want to beat your competitors. We want to make sure that our drivers that get exams with you are not going back to those third-party consortiums that are taking advantage of them because you're able to offer them every single thing that they need. Everything, including the reporting and the randomizing. So you can also look at a one-time annual fee of $99 or $199. Now, if you are in an area like I know West Texas, I've recently learned they're very expensive. They charge $95 just for one drug test. And that's not even a pre-employment. That is pretty expensive to me. A pre-employment test nationwide is about $75 generally speaking. But if you're in West Texas and you're setting up your consortium, you can charge more comfortably than $240 like I talk about. You could easily charge $250 or $275 or $300. You could also charge a little bit more than maybe $99 a year for an owner operator. You might be able to charge $125. It really depends on your area, okay? But keep it competitive. I'm watching you guys set up these companies for your consortium ongoing. It is so wonderful to see you guys, even though some of you are only doing 2 a week, there are others of you that are doing 5 a week. And there are others of you that are getting those clients that have 25 drivers or 30 drivers, and that's wonderful. So just keep it moving. But your owner operators will mostly be the ones that need this service, and your employers that have drivers, I would say under maybe 40 drivers and below, they're going to be the ones that need your help. The other employers that have a few more, because they're a little more sophisticated, they probably will do it themselves. But we need to include this as a part of the service to your consortium. You should consider adding that cost to your letter or adding that cost to your consortium enrollment paperwork if you're serious about managing their clearinghouse. Now, if you don't do it, they are either going to go somewhere else and pay them probably more than you would charge, or they're going to do it themselves or take responsibility for doing it themselves. And in most cases, it won't get done and they'll end up in trouble. So again, icing on the cake, this is a service that is a gift for you to service your client and your employers and your drivers even more. And now the reason this service is so important is because you're building a relationship with the employer, even if it's an owner operator with one other driver or just themselves. Owner operators grow. Owner operators talk to other owner operators. So this is very exciting. It's responsibility, but you've already taken the responsibility. Why not make it a full service program to go along with your consortium? Okay, that's my thoughts. We'll keep an eye out for the pricing and what's going on in the different areas. One last thing. How often should you conduct drug and alcohol testing? First, you should be testing for the following reasons when needed. Pre-employment always. That's part of the clearinghouse situation, right? But that is an extra charge, okay? That is not included in your consortium. That's being done across the board nationwide. That's extra revenue. Reasonable suspicion, we suggest that you do include that in your consortium as is already set up in the enrollment paperwork that we gave you when you joined the program if you are in the consortium. Return to duty, extra charge. That's a whole different extra charge, additional revenue. And you'll find that out through the employer, okay? Because now the employers are going to be more conscientious about following the law because they know they're being watched. So all these return to duty situations that used to get away from everybody, they won't get away anymore. And by the way, don't forget pre-employment DOT physicals, pre-employment drug and alcohol testing. Alcohol, it depends on if they do that to everybody. If they don't do it to everybody, you can only do pre-employment drug testing and the pre-employment physical exam. Return to duty, the same thing. Pre-employment drug testing and return to duty, same thing is going to be drug testing before they can go back, and then also the DOT exams before they can go back. Okay, so you're doing both of those, and those are extra charges. And then follow up, the same thing, extra charge. So you need to make sure that you're paying attention to why these people are coming in. And these 3 reasons, pre-employment, return to duty, follow-up, are not part of your consortium. They're in your consortium and they have to come to you, but they pay extra. Post-accident is part of your consortium, and random is part of your consortium. Okay, so I haven't even counted your additional revenue opportunities for the pre-employment and the return to duty and the follow-up. Those have never been included in my examples of what your consortium can do revenue and income wise. So you need to do that. I mean, you don't know when they're going to come, how often, but again, more icing on the cake. Thank you guys for joining me today. I'm Michelle Brown. Most of you know me, if not all of you. Go ahead and send me your questions if you have them. I will be sending you guys a copy of this training right away. If you are already in the consortium, this will also be in the consortium portal. If you are not in the consortium, you will not have access to the step-by-step documents because you really won't need them until you decide if you want to be in the program. But if you're in the program and you need to know how to register or help an employer register, we're going to have that step-by-step document in there so that you can help the employer. But the regular replay will be available to everyone. If you are in the consortium, you will get not just the replay, but all of the documents inside the consortium portal. Thank you, and go ahead and send me an email if you have more questions at rvp@dothealthsystems.com. Have a great weekend.